Okay, serological. Okay, we have only 5 minutes here, but try to complete it. Got disconnected. Anyway, so we were on tuberculin tests. Tuberculin 6 skin test. Tuberculin skin test is positive, which provides evidence of tuberculosis infection. Many HIV infected patients will have a negative skin test despite infection or the disease. The test is neither useful to rule out a disease nor it's a in high TB prevalence settings to identify eligible individuals for prophylaxis. Other diagnostic techniques involve interferon Y release assay. I'll suggest you guys to read this by yourself. I'll stop here for 10 seconds. You can go back and read it because we lost time due to poor connection. Now, the other test is sensing volatile organic compound. Volatile organic compounds for tuberculosis bacteria in exhaled air or urine or headspace gas over sputum or bacterial culture measured using the sensors of or gas chromatography. Mass spectrometry is a new technique. In the urine of tuberculosis patient, it is found that infection with tuberculosis produces a distinct pattern of certain VOCs. Identification of these patterns sets the stage of developing a portable electronic nose that can quickly sniff urine samples to detect tuberculosis. Okay. What is electronic nose device? Electronic nose devices are an array of chemical sensors combined with some sort of pattern recognition system, which are being investigated to differentiate between sputum sample of TB patient and non-TB patients. The function of an electronic nose is to mimic the mammalian olfactory system and produce a unique classification based on the volatile organic compounds in sputum. Screening of HIV along with screening of HIV among individuals with active tuberculosis with regards to detecting HIV among with regards to detecting HIV among individuals with active TB provides initiated HIV testing is recommended for all TB patients as Preventing TB in HIV patients. The WHO currently recommends that all HIV infected persons be screened for TB and HIV infected persons with active TB disease to be evaluated for treatment of latent TB infections. The most widely recommended regime for TB preventive therapy is isoniazid 300 mg daily for 6 months. WHO guidelines 2010 strongly recommend the use of 6H regime with 36H with 3 years of isoniazid being a conditional recommendation of countries to adopt depending on local needs and resources. Symptoms of screening can detect culture confirmed TB disease with greater than 90% sensitivity and 97% negative predictive value. Coming to the treatment, it is currently recommended that HIV-infected individuals with TB receive combined treatment for both diseases, irrespective of CD4 plus cell count. ART along with ATT is also available treatment in present time. Though the timing of starting ART is the debatable question. The advantages of early ART include reduction of early mortality, reduction in relapse, preventing drug resistance to ATT, and reduction in occurrence of HIV-associated infections other than TB. The disadvantages include cumulative toxicity of ART and ATT, drug interactions leading to inflammatory reactions are the limiting factor for choosing the combination of ATT and ART. The strategy for initiation of treatment of both TB and HIV infection are criteria. So these are the criteria, and these are the on the middle there is a the table shows criteria, TB treatment and ART treatment strategies. I think I'll not go into the details because we are losing time because of frequent disconnections. You guys can read it by yourself and write it down. So ATT antitubercular treatment. Standard therapy consists of 4 drugs in the intensive phase of 2 months, namely isoniazid, rivamicin, parazinamide, and ethambutol, followed by H&R in the continuation phase of 4 months. ART is the WHO guidelines for management of HIV-infected TB patients recommended the combination of 2 nucleoside reverse transcriptase inhibitors along with 1 non-nucleoside reverse transcriptase inhibitors like NRTs and NRTIs and NNRTIs. Tuberculosis